From the RSNA, this is the Imaging Cancer Podcast, and my name is Dr. Lauren Burkard-Mandel, and I am an R4 diagnostic radiology resident at Case Western Reserve University, University Hospitals in Cleveland, Ohio. Today we are going to explore a topic, women in radiology. Our third guest is Dr. Elizabeth Arleo, a professor of radiology at Weill Cornell Medical College and attending radiologist at New York Presbyterian. Dr. Arleo has been involved in women in radiology groups at the national level, where she served as the president of the American Association for Women in Radiology in 2019 and has served on the ACR Commission for Women and Gender Diversity. Additionally, she is the founder and director of the mentorship program for women in radiology at New York Presbyterian. Dr. Arleo, welcome, and thank you so much for taking the time to speak with me today.
Thank you so much for having me and the invitation.
So please tell me about your focus on women in radiology and what drives you to continue to participate in these groups.
Absolutely. It really began out of personal necessity. When I was a junior resident, and the burning questions I had were, when's the best time to have a child? And then, how come I now only have 6 weeks maternity leave? And after I had the child, how am I going to, manage being a professional working mother? And when I went to conferences, these are the questions I wanted to have answered, and I wasn't finding my answers. So I figured, if anyone is going to be talking about it, it's going to be in some sort of women in radiology organizations, and or if they're not talking about it, then it's going to be a safe space to raise the issue. And that's how I got involved with the AAWR when I was still a more senior resident and fellow. What compels me to continue is it is so gratifying that the work that I've started and I've done with many other colleagues in the AAWR, like Kirti Magudi and Kristen Porter, has now, what began as just like a small group of us, talking after hours and planning and strategizing. It has become now a national organization with multiple committees, which I can talk about, and the work is just continuing, and it's so gratifying, and there's still so much to be done. So it's been a career passion of mine, and it's not going anywhere, and so I continue to be involved for all those reasons.
Yeah, I love that, and I think as a resident, kind of earlier in a place where I'm early in my career with young kids, I really appreciate that, because I think it is a challenge in medicine, and we don't want it to be, but the reality is that it is difficult to navigate being a mother and being in medicine. And I think it's really important and really helpful to have women who have kind of paved the way and, started having these conversations at the national level and enabled someone like me to have a full maternity leave for this country, which, we know worldwide is maybe not the best standard, but as a resident, to be able to have a full maternity leave was really special and really important. And I think that's not happening everywhere. So for the younger trainees, this is really important and really practical work. I mean, this is affecting women on a day-to-day basis. So,
absolutely. Yes. Radiology, is the only specific specialty, to the best of my knowledge, which has its organization, the American College of Radiology, which, has a specific past resolution recommending 12 weeks of paid family medical leave for all genders, including residents. So, and having that as an active supportive statement. I don't know of another specialty that does. So I think, towards your last question, which I see on the list about what is the best way to increase female recruitment in radiology, something like that I think should be much more visible. We should be proud of it. And it's not like the reason to choose radiology. And yet, if you're interested in radiology, this is a really important thing to know about, and also know about that your colleagues before you find it important and have worked for it. That might be confirmed for someone they're, really in the right specialty, because a lot of how we decide specialty is how you feel with the people around you. So I think that's important for visibility.
Yeah, I think that's a great point. I think it always surprises me personally when we look at the numbers of how few women there are in radiology, because to me, it fits so well with my personal life and having a family and having young children. Being a resident is challenging no matter where you are, no matter what you're doing, and being a mom and a resident is challenging. But radiology is flexible and you can work from home and it's so well suited. And like you said, we have these national policy statements directed towards medical leave and so many scenarios that to me make it an ideal field to be a woman in medicine and a mom in medicine, but we're still lacking. And so I think to increase the visibility of those opportunities in those statements is really important. I agree. What can you tell me about women in radiology initiatives at the national level and kind of your role in them and what opportunities are there?
I would say that in alphabetical order, I guess, the AAWR and then the ACR, specifically the ACR Commission for Women and Diversity. And, in terms of advice for listeners who might aspire to get more involved, I definitely think membership can be expensive. But once you get out, if you're going to put your hard-earned dollars to organizations' dues, I would say the ACR really is your voice as a radiologist for making policies and so much, so important. And then after you pay into the ACR, please join us at the AAWR at a lower rate, because being a member of these organizations is really crucial. And then you can go to the meetings of areas that you're interested in and then follow up and pursue what you're curious about and what you'd like to get to work on. And then it doesn't feel like work if you're pursuing something that you really care about.
Are there opportunities, I know within the ACR, but within the AWR too, for trainees? Do you have trainee panels or trainees involved in those organizations?
Yes, absolutely. You can just go to the AAWR website, click membership, join, and then there is a volunteer form. Like there's a call for volunteers, so you can fill out your interest. And then when the different committees are made, you can get slotted into one of them. There's an advocacy committee, which is doing continued work on paid family medical leave and everything, to reproductive health rights. There's also a dedicated member in training committee, which is one of our most productive and important committees. So like the time to get involved is now. Members in training are our pipeline in every which way. And the AAWR is a very, I think, relatively easy and accessible way to get involved and to meet like-minded people and to learn how to navigate national societies and make connections and gain leadership skills. I mean, I can't say enough. AAWR has been a game changer, a career highlight, and I'm really, really grateful.
Yeah, that sounds like a really fantastic opportunity for anyone, but for
Yeah.
trainees, junior faculty, people wanting to get more involved at a national level. So that we'll link that with the podcast as well, so that people can find those websites. I think that would be
Please. And then I'll also add that the AID and the ACR has many important committees and commissions, but specifically the Commission for Women and Diversity has a diverse member group. And I do believe, I have to check this, but have members in training, a select number of members in training as well. That would be another way to get involved. And would be open to someone who wanted to come if they were getting ready to graduate. And both places, people want you to get involved.
Yeah, and I think that brings us to a really important point about the role of women in radiology groups and groups promoting diversity, not just in gender diversity, but also in racial diversity, ethnic diversity. And I was hoping you could talk a little bit about the interplay between those two and kind of the role of women in radiology in promoting overall diversity in radiology.
Such a good question. I mean, as we alluded to earlier, women in radiology are still a underrepresented minority still, and this statistic hasn't changed in several decades. The percentage of practicing radiologists who are women is only about 25%. So by far an underrepresented minority in terms of gender. And so I think with women in radiology and racial ethnic minority groups share that they're underrepresented in radiology. And of course, there may be an intersection of that Venn diagram of a woman who's also an underrepresented minority. And so I think there are similarities that people could, work together to forward their priorities. And we need more people involved in both these organizations because we only each individually have, a limited bandwidth and can only pursue so much, and yet we have so many important agendas that need to be advanced that we need people to be doing it, and we can work together and support each other and amplify each other's work.
Yeah, and I know on a personal note, our women in radiology group at Case, we do represent a pretty diverse. Obviously, we're all women, but we do represent, some significant racial and ethnic diversity, especially for the field. I mean, if you look at the numbers versus the percentage that we reflect, and I do think that for all of us personally in conversation, the existence of that group really drew a lot of us there, and so I think in promoting that and in kind of showcasing your diversity, you can attract more diversity. And I think, there's a lot of studies to support that. That's not just, anecdotal, but I think for our institute, for sure, that women in radiology groups specifically has played a really big role in that. And I know we talked about getting involved early in some of these more national groups, but what are some other ways that you think that young trainees or people early in their career can really start to integrate this into their work and get involved and try to promote women in radiology?
I think it can be both top down and bottom up and everything in between, in terms of a place to start at the national level, membership and involvement in the ACR and the AAWR would be a good way to start because that can be a lot, you can get from them a lot of ideas and then bring them down to either your state chapter ACR and or to your, local institution. When I was a fellow at Cornell, I started the mentorship program for women in radiology, and I was really inspired to do that by the AAWR. I felt like, it was like an arm of the AAWR, but it was indirectly. But I was inspired to bring that to my local institution. And then, from the bottom up, if you have a women in radiology group, I, highly recommend when we meet once a semester, I send the invitation to all 4 years of the medical students, residents, fellows, attendings, and we invite all genders. And having the medical students there is really valuable for everyone. We're all on this spectrum of learning, and in terms of like the pipeline and developing the next generation, it's invaluable to have medical students come to these non-interpretive skill type talks because it's really an opportunity for them to explore a potential field in another way, increases the visibility of everything we're doing, and is a great way to get involved. And they ask, questions that just are fresh and different because everybody has a different perspective, which again speaks to the importance of diversity, not just gender and racial and ethnic, but also like age and years of training.
Yeah, I would actually love to hear a little bit about the different programs that you integrate into your women in radiology group, your local group at Cornell. I would love to hear kind of the programming that you put on or the most powerful programming you think you have there. Just because I think a lot of our listeners will probably be involved in women in radiology groups that would love some ideas.
Yes, actually, we just had our first semester event last night. We had Dr. Nina Kapoor from the MGH Brigham. She was at Cornell to give grand rounds. Very, very impressive. And so then after the more like formal professional component, I had her speak at the mentorship program for women in radiology in the evening. And the way basically we meet once a semester. And again, it began when I was a fellow and I had this infant, and I look at the successful women in radiology around me, and there are quite a few in New York, and I wanted to hear their more personal story. Like, how do you do it? How do you do it? And so I just started with once a semester, over wine and cheese. My husband's been donating the wine now once a semester for 15 years. And our program provides like lovely cheese and, crudité and stuff. I just started with having local women come and talk about the more personal side of their story. And early on we had from HSS, Hollis Potter, we had Dr. Resac, who was the chair of Memorial Sloan Kettering until earlier this year. And then once I had, sort of exhausted the successful women in radiology in New York, I looked to our grand round speakers, and often there wasn't much of a choice. I've been doing this now for 15 years, and there would just used to be just like one female grand round speaker a semester. So it was like, okay, you're and so with everyone has a different story, and we learn something different from each story, and that's it. That's how I've done it. And there used to be another component, which was, so that's the like once a semester sort of networking type event. And then the other component was pairing all incoming first year female radiologists with a two-tiered mentorship program with both a more senior female radiology resident and a female faculty member. And that became so successful that the male radiologists also wanted in. And so I have delegated that to the chief residents, and it's now just part of our program mentorship.
I like that formal mentoring between, female residents and attendings. That sounds like really valuable. And we do a similar program to what you were talking about at Case, where we do spotlight lunches. And it's something I've discussed earlier in the podcast as well, because that's my favorite type of programming that we do too, because it really is so important and so inspirational and so helpful to hear about the career progress of other women in radiology. For me personally, other moms in radiology, to hear about women who, worked part-time and then went on to be
Yeah.
chair of their department when they ramped up after their kids got older. So it's really helpful to hear other women say, this was my course, this is how I got here, and I was in your shoes one day and I never thought I would be to this place. And that's the recurring message, is when I was in your shoes, I never envisioned this career for myself. And I think as a trainee, it's hard to picture, that prolific career for yourself. But it's really been amazing to hear, just how women have progressed. So I agree. I think that's my favorite programming we do as well, is just hearing those stories.
And if you'd like to hear more about my story, readers can find on Amazon or bookshop.org. I also published earlier this year my first book, First Eat Your Frog and Other Pearls for Professional Working Mothers.
So your book was actually featured in our Women in Medicine, so greater group at at Case. They read this book earlier this year, or last year. I think I was on maternity leave, so I wasn't a part of that book club, but I have it on my phone because they read it for that, and I was planning to read it too. So I'll definitely take a look at that.
Thank you. Thank you. I didn't know that. That makes my day to hear it.
Thank you so much for chatting with me today, Dr. Arleo. I really appreciate your time and your guidance, and I look forward to chatting with you in the future.
Absolutely. Pleasure. And thank you again for this opportunity.